After a severe stroke, the brain is injured and patients require admission to the hospital. Sometimes after the stroke, breathing can fail, requiring a breathing tube through the mouth connected to a breathing machine. Sometimes it's necessary to place a temporary tube that enters the airway through the front of the neck, called a tracheostomy. The breathing tube in the neck is more comfortable than a breathing tube in the mouth and may require less sedatives and less time on the breathing machine. We think it might help to perform a tracheostomy within the first 5 days rather than the usual practice of waiting longer than 10 days. The best timing for placing this tracheostomy tube is unknown, and the Setpoint 2 study has been developed to determine the best timing for tracheostomy after stroke. In this study, there are 2 different groups. All participants will be randomly assigned to one of the 2 groups. This means that groups are assigned by chance. It's like flipping a coin. In Group 1, participants receive a tracheostomy as soon as possible and always within 5 days. In Group 2, participants will receive a tracheostomy after day 10 and only if they cannot be safely weaned from the breathing machine. The only thing that differs between the study groups is the timing of the tracheostomy. Both groups will receive standard of care treatment as recommended by current clinical guidelines. The risks of the study are the same as the risks of the tracheostomy being done too soon or delaying it too long. The first group may be at risk for unnecessary surgery. The second group may need more sedation and have a longer intensive care unit stay. If you choose to participate in this study, we will collect information about the stroke, what treatments were given, and how you are recovering. We will also be asking how the experience affected you and your caregivers. If you choose not to participate, you will still receive standard treatment, which is likely to include tracheostomy if deemed appropriate by your doctors.